Medical Monday is brought to you by East Cooper Medical Center.
All right, today I'm back at East Cooper Medical Center with Dr. Lindsay Vancia. How are you doing today?
I'm great. How are you?
I'm doing great. Now I want you to tell me a little bit about where we are and what you do.
So we are in the interventional lab here at East Cooper, and in this room we have vascular services, some general kind of interventional services, and as well as some imaging. So myself as well as some of the surgeons work out of this room. The type of radiology services we offer here kind of across the board. So we, for imaging, we do X-ray, CT, ultrasound, and MRI. We also have a really robust mammography and women's breast center. And then the interventional services or the special procedures areas where we do all of our image-guided procedures.
Now, what do you think sets East Cooper Medical Center apart from other places?
I think it's the accessibility. I come from an interventional perspective where patients have to call and schedule ahead of time, and they may be waiting a week to 2 weeks sometimes to get in when they need like a biopsy to figure out what their cancer may be. Here we don't have that limitation. We try to keep our schedule more open, so patients usually can get in the next day or within a couple days. So I think that's really what sets us apart, is just our accessibility, being in the community.
That's fantastic. Now, what are the different types of patients that you typically see on a daily basis?
It depends. We see some inpatients, and those are going to be kind of our sicker patients that need more kind of emergent services. Sometimes we're trying to stop bleeding, or we're wanting to make sure they have good access for kind of helping clear their kidneys and things like that. But then on an outpatient basis, we see everything from a kid that fell on the soccer field and broke his leg, and we need an X-ray, to really advanced services. We offer some embolization services, especially for women, or some kind of high-end vascular services for people that have occlusions in their legs.
Now, I can imagine that technology is changing all the time. I mean, how do you guys keep up with it?
Well, it's a big job. And we're lucky, though. Technology has aided radiology probably more than anything else. So, when people think of X-rays and radiology, they picture us kind of looking at films through the light because, television shows tend to show that. But it's not like that anymore. It's all digitized. And with that comes the capability to do things more quickly and make them more pain-free for our patients, so they're not kind of going through the procedure for so long. So at East Cooper, one of the things we just installed is something called CT fluoroscopy. So when we do procedures under CT guidance, instead of having to kind of leave the room, take a scan, come back in, we can actually be right next to the patient the whole time and take real-time images. So it really expedites the process for our patients and allows us to be more hands-on.
Wow, and what are some of the goals that you have as a doctor with every patient that you see?
The biggest thing is I want them to understand kind of what we're doing. As radiologists, we tend to kind of serve as the kind of doctor's doctor, so we have to rely on them to send us patients. And so they, a lot of times when they get here, don't know exactly why they're here, what we're doing for them, how we can help them. So I think the most successful patient interactions I have are the patients come out understanding what we did, kind of what the benefit was for them, and then what they can expect next.
Medical Monday is brought to you by East Cooper Medical Center.